Becky, if I could perhaps ask you just to talk a little bit, very briefly, about how long JLA PSPs take place. Um, what's the longest kind of time that they've taken? What's the part of the process that takes the longest? So people are very interested in the length of time that the PSP takes to run.
There's some really good questions in the chat. So
Yeah.
thank you for those and thank you for engaging with it. So it's, I would say, in my experience, that the most challenging part of the process is the engaging with people, making sure that the PSP can hear from whoever they need to hear from, and that's the thing that takes the time, because it's very easy in the UK to send out an online survey to contacts that you know, but are you actually hearing from the appropriate people? Are you hearing from that really wide range of voices? And PSPs are not about getting thousands and thousands of survey responses. They're interested in ensuring they're hearing from that wide, diverse group of people. And that might be people we don't normally hear from. It might be young people or old people or more marginalized people. And that's the effort and the time it takes. The other side of it is the data processing. You've heard, you try and engage as much as you can, and you hear those narratives, and it's then processing all of that data. So those are the steps that usually take the longest. But it's all down to that hardworking steering group and the effort they put in. They typically meet monthly, and we expect them to do lots of work, to be involved, to really get involved in seeing those responses and deciding what categories we put them into and how we create those summary questions, because it's really important that the steering group members, who are the patients, who are the clinicians, can ensure that those voices are properly being represented. So it's a year to 18 months, but it's a lot of hard work. But in Zalalem's case, circumstances don't always mean that happens. There's lots of external factors in all of these things, and it's down to lots of different things.
Thank you
Bit
so
waffly,
much.
sorry.
No, no. I wish we got more time really to take questions, because it's such a fascinating discussion. On the topic of engaging, the challenges of engaging people, we've had a question from Janet about how what were the challenges that you had in finding people to recruit to your steering group. And I'd like, if I can do this, to ask you about the challenges of engaging with women on this very sensitive subject, and how you coped with that. Zelalem, could you perhaps answer that?
Okay, thank you. I mean, of course, it is very true to get, patients with the problem, as well as engaging in the steering committee. We don't have, as the classic PSP to advertise, or, online. We don't have such privilege. So what we use this, because I'm a urogynecologist, so I just give call to patients I treated before, and then also communicated with these patients and carriers to speak with other patients and carriers who knows. Then we collected those who we know, as well as other patients and carriers, and the midwives working with me now. So many of them are what we know them previously, and willing to be part of this process. Then after we discussed how we can identify the other majority of patients and carriers, then we used, the data from the local health offices, because these patients, they usually they registered them for having treatment. They have a long list of these patients, and they have also their phone numbers. So we used that as a means to reach out to these women. This is how we reach to these women. Thank you.